to the Master Clinical Dentistry Institute, where we train students in each and every field of dentistry.
In this video, we will be discussing about the gingivitis, the symptoms and causes of gingivitis that affect the oral mouth and the questions related to it. Gingivitis is basically a mild gum disease. It is an infection that is caused by bacteria and it hurts the gums. It occurs when there is a buildup of plaque on the teeth and the plaque contains bacteria that can irritate the gums and cause infection. It can occur at any age. The bacteria residing in the plaque product acid by reacting with the food that causes the gingivitis. Now the causes of gingivitis. It is the aggressive toothbrushing. It can be blood disorders like leukemia, deficiency in vitamins, especially vitamin C, dry mouth, formation of plaque that can cause tooth decay and gum infection. The most important is the hormonal changes. It can be mostly seen at the age of puberty, pregnancy and menopause because it makes all these conditions it makes the blood tissue more vulnerable to bacterial infection. Causes of gingivitis are poor oral hygiene, uncontrolled diabetes. There are certain infections, malaligned teeth, some systemic diseases, pregnancy, use of certain medications and some oral appliances when the patient is not able to keep them clean. That are the main causes of gingivitis. Signs and symptoms are how will you observe that it is a gingivitis. There will be bright red or purple gums, shiny gums, gums that are painless except when pressure is applied, the gums that bleed easily, the receding gum line, bad breath, inflammation and soft gums. These are basically the signs that you can distinguish it from the gingivitis. Now how will you diagnose it being a dentist? You can diagnose it first of all by taking an X-ray because that shows the level of the underlying bone, whether there is any bone loss that is related to periodontal disease. There can be vertical bone loss or the horizontal bone loss. By examination of the sensitive teeth that have become more sensitive around the gum line may indicate the receding gums. Now measuring the gums, that is an important factor. How will you measure it? You will measure it by the use of periodontal probe that has marking on it. Okay, to know the depth of the pockets that are around the teeth and generally healthy gums have a pocket of around 1 to 3 mm and beyond that if the pocket is beyond then that indicates that is the gingivitis. Now the treatment is scaling and root planing, curettage. Root planing is basically the smoothing of the root surfaces that the gum tissue can reattach to the teeth. Curettage, there's a hand instruments that are available, hand curette, posterior curettage and anterior curette instruments that can be used, and it is a removal of the soft tissues that are lining the periodontal pocket. This helps the gum tissue to heal more easily.
You can log on to www.masterclinicaldentistry.com or you can call or WhatsApp on +9 1 7 88 909 3147. Our institute is located in India. You can also contact us via email, that is masterclinicaldentistry@gmail.com.